And here we are with Joe Scott Jones on the couch. Joe, end of another big conference, a different conference this year because it's got a different focus, a different flavour to it, and having RANS as part of it. How has that been for you?
I think it's been really exciting. I've been really pleased to have people from Federated Farmers, rural contractors, the Dairy Women New Zealand, Dairy NZ, people involved in the process of the conference, but and also contributing on the floor. Unfortunately, I've been able to get into the keynote speakers, but a lot of my time during conferences is spent in side meetings and so on. So I've missed a lot of the breakout sessions. But no, I think it's added a great deal to the conference. I'll be very interested to hear how the nursing and medical delegates feel about it, and whether they feel that it's added a different flavour to it, which is valuable.
Yeah, I mean, it's interesting having the RANS people here, as long as the rural hospital doctors, so it's a rural meeting now.
Yeah.
And it's gone away from a general practice network, and I think that seems to me to add a richness to the whole thing.
I think so, and hopefully not missing the educational opportunities and for the rural doctors. I think one of the key things that I've heard and been involved in over the last couple of days have been discussions around rural training pathways, and so recognising the importance of that, the opportunities we have with the changes in the numbers of medical students coming through, a focus on general practice as an outcome for increasing medical students, and then obviously the opportunity that provides for us to bring those people into our rural and provincial regions. And it's very exciting. It's actually, there's lots of opportunities. So that sort of planning around that has been really good. I'd have really liked to have gone to the airways workshop and the surgery workshop and those things as well, because for my own practice that would be really good. Maybe next year.
Maybe.
Yeah.
One of the things that I've found, especially at the training program, I was at the meeting on Thursday, there's an awful lot of training happening. Some of it's very coordinated and some of it's quite ad hoc, and I think a lot of people in the room were quite surprised as to how much activity is going on around the place, but it's just making everyone aware of it. And Tim Malloy's starting a task force to look at coordinating the training and look at what's been going so that everyone knows what's happening, which is good. One of the comments that I've heard a lot of is that I'm I'm a rural doctor, but I actually want to, do I have to keep in this stream or can I go to the RAN stream? Because there's a whole lot of crossover, and that's quite different because people think they have to stay in their own streams.
Really?
Yeah. So that's been very interesting. People wanting to hop.
I'm not allowed. I'm not allowed to go into that room over there because it's a RANS room.
Well, I think people think because they've. I don't know.
Isn't that
is there rules?
No, not at all.
Yeah, well,
and that was part of the richness of a rural health conference, a national rural health conference, is that ability to say, well, actually, I'm quite interested in the economic future of my community. That's happening in that room at the same, unfortunately, at the same time as we're talking about the management of gout in rural Māori. That's part of the challenge of a really good conference is being provided with lots of different streams that you have to choose between. Yes. I've certainly seen GPs and nurses in those community stream discussions and had good feedback from them. Ernesto Ciroli this morning in the workshop talking about a way of bottom-up thinking within communities to improve economic outcomes for small rural communities, and it was great. It was really good, and there was a real good mix of people in that room there this morning. So that was good.
I've seen more students here this year. In fact, year on year, they're growing and growing. And their enthusiasm is it's changed as well. It's almost as competition to I don't know whether it's placement competition, but they're far more engaging and
I think we're lucky with the Rural General Practice Network has 2 students on its board, and I think they're both 4th year students, Blair and Caitlin, and they're both have come onto the board as there's been a transition at the end of last year, but they've both hit the road running, and they're doing a really good job. The Rural Network is also planning and the planning development stage of a rural student mentoring program. And I think so they're having those conversations, and I think that might have added to it. But I also think that we're being successful with demonstrating the value of rural training to our undergraduates. I think the message is getting out there that if you're do training in a rural area, then you get a breadth and a depth of experience, which is hard to achieve in urban centres where you're competing for your trainer's attention with other trainees, and you're also competing for patient time with other trainees and so on as well. So, it's I think maybe the message is getting out there as well.
We had 2 third years on the couch before, and they commented both on and off camera how they realised that they had to plan their careers early, and they wanted to show enthusiasm to the people that needed to know year 3 for placements later on. So I thought that's very wise. So they're getting smart, these kids.
I was approached by one of them
over
coffee, I think. So that was really good. Yes, we'll look forward to seeing her in Whakatane at some stage in the future. I will now be inundated with students, of course, because everybody wants to come to Opotiki and the Eastern Bay of Plenty.
Well, and we've got the same issue on the surgical bus. We've started taking some 5th years, and we've had 5-week stretches for 2 of them, and now they're lining up in droves to come on board.
Good. Well, not unsurprising, because it must be a fantastic experience.
Yeah, they get a unique experience because at 5th year they're surgical assisting and alongside, and you can't ask for more than that.
Yeah. That's good.
So conference almost over. Ready for a cup of tea and a lie down at the end of it?
Yes, definitely.
Yeah. You're off to Dubrovnik for the Wonka?
I am,
yes.
April the 12th to the 22nd I'll be there.
Yes.
A long way to go it's a 4-day conference. I think I've got 5 abstracts that I'm presenting around rural New Zealand and how we're doing things here to that international audience, and I'm involved in another 3 workshops and things that I'm sort of co-presenting. Martin London and Sharon Hansen from the Rural GP Network will be there as well. So I'm there as partly for the network job, but also as representative of the college on the Wonka Working Party for Rural Practice. So I'm excited about that. It's always invigorating, and meeting with international colleagues. Seeing the world through other people's eyes is what we do every day. Getting a reflection on our world from an international view is exciting. New Zealand leads the way in some aspects of interprofessional education. We lead the way certainly in the role of nurses in primary care, and so we've got a lot to share, a lot of good things that we can we can take overseas and demonstrate. So yeah, I'm excited about that.
So Joe, as part of the RANS meeting, I understand there was some discussion the other day about the rural broadband rollout.
Yeah, it was one of the top 3 priorities for RANS over the next 12 months. Mental health issues, getting a research agenda and information about what's happening out in rural communities, and access to technology and broadband is a key activity. We see it as a key. All of the RANS member organisations see access to broadband as a key enabler of improved outcomes in rural health. Partly so that people can access education activity, so that we can actually provide services using telemedicine and teleradiology and so on. But also it's about livability of rural communities. One of the local government New Zealand representatives talked to us about the questions that people ask when they move to a rural town, and one of the key things they ask is, how good is your broadband?
Yes.
And which of course it is. That's what you know, it makes life different. I couldn't live without Twitter.
No, but Twitter now, television through the streaming,
Yep.
And people just feel isolated if they're not. So that's good. So what's the plans for the Rural Health Alliance to get going? What's Rans going to be doing?
Well, a really interesting. We're in that stage in Rans's life where we've set our goals. We've got our common ground. Mm-hmm. We're now needing to actually get some runs on the board and to be seeing some actions around our outcomes. So in terms of the rural broadband, we've partnered with TUANZ, the Telecom Users Association in New Zealand, and are going to be participating in a workshop to look at the issue of the extra 150 million which the Ministry of Business, Innovation and Employment is putting into rural broadband, and looking to develop some advice for the Minister about how to make that money really do the work that it needs to do in rural areas.
Very good. Thank you, Joe. Appreciate your time.
No worries. Thanks, Mark.